make steep cuts to WIC that would have seriously cut benefits for millions of women and kids, we successfully fought together to keep WIC fully funded. This bill ensures that 7 million moms and babies will get the full nutrition benefits they rely on. We also sustained key investments in our rural communities. Because we rejected a Trump funding takeover, we protected housing support in rural communities and vital agricultural research happening across the country, including in my home state of Washington at WSU. We stopped Trump from blowing a truly massive hole in FDA's budget, which would have slowed drug approvals and seriously endangered our food supply. None of this is inconsequential. All of this matters. And I want to thank Chair Hoeven and Ranking Member Shaheen for all of their good work on that vital bill for our communities. In the military construction and Veterans Affairs bills, we were able to secure funding to make sure we're taking care of our veterans and our service members, and ensure that this administration keeps its promises to our veterans by ensuring staffing of critical services such as the crisis hotline centers. I want to thank Chair Bozeman and Ranking Member Ossoff for all their good work on this critical bill for our veterans and service members. And lastly, on the legislative branch bill, which is the smallest bill, it covers the important needs of this institution, from protecting GAO and CBO, the architect of the Capitol, our Capitol Police, and other agencies that actually make this place work, to make sure our offices have what they need to take care of our constituents and keep our campus safe. We should all appreciate the hard work that went into completing that bill, and I want to thank Chair Mullen and Ranking Member Heinrich for all their work on that important bill and the critical matters within it to every senator in this chamber. Now, obviously, those are not the bills I would have written on my own. I have concerns we were not able to address in these bills, and Republicans were not open to some of them. But I still want to do more, Mr. President, when it comes to delivering critical investments for our communities and our country. And I will, as always, keep pushing my colleagues every day. But we did secure real wins for folks back home when Democrats and Republicans were able to sit down at the table together on funding. And they are immeasurably better than Trump and vote holding the pen, which is what the slush fund CR that we have been operating on this year has allowed. I'm proud of what we have been able to negotiate to protect key programs families and communities rely on, and protect our authority as lawmakers who are here to be a voice for our constituents. I want to emphasize that I really appreciate the work of my counterpart, the senior senator from Maine, Susan Collins, who's done incredible work on all these bills. I want to thank our subcommittee chairs and ranking members and all of our staff who worked hard to put these bills together. And I want to make clear I deeply appreciate the partnership of my colleagues on the Senate Appropriations Committee who've all worked in good faith during these very difficult times and these very difficult negotiations. No matter what, these bills need to get done. And our staff put in late nights, and our chairs and ranking members held countless conversations to compromise and work towards solutions. I hope to continue building on that progress and showing what it does look like when we come together and put families before politics. I look forward to getting our next minibus up on the floor to move multiple needed bills along that we have marked up in the committee and get those to conference. And I hope we can be on that package as soon as possible. I look forward to working with the senator from Maine and working to get those final bills completed so they too can be conferenced with the House as soon as possible. And I want to thank all of our committee members and staffs for their incredible work on these critical bills. We have a lot of work ahead, and I know we can get there. Passing full-year funding bills to ensure that Congress, not Trump or Russ vote, decides how taxpayer dollars are spent. We should never turn the keys over to Trump and his cabinet secretaries, allowing them to make unilateral cuts and to shift funding around however they please. Every day, they prove in a new way how critical it is that Congress assert its authority and rein in their chaos, and I will continue working to do that on the Appropriations Committee. But I also, Mr. President, need to continue fighting to stop the mega healthcare hike for as long as there is still time left on this clock to fix this. The reality is there is a point where it will be too late to make a meaningful difference. But until we reach that point of no return, we do have to fight tooth and nail to force Republicans to actually work with us on that issue. And because in this package, Republicans have yet to refuse to address the health care crisis families are facing right now, a crisis that gets work and harder to fix every single day, I will be voting no. Thank you, Mr. President. I yield the floor.
President.
I recognize the senator from Maine.
Mr. President, this is the 41st day of an entirely unnecessary government shutdown, a shutdown that never should have occurred, a shutdown that has caused tremendous harm to the American people, to our national security, to our entire country, a shutdown that has resulted in federal employees being furloughed, laid off, or forced to work without compensation, a shutdown that is causing enormous uncertainty and stress for families that rely upon the SNAP program for the nutrition that they need, a shutdown that is causing families to wonder, are they going to be able to fly to see the grandparents on Thanksgiving, a shutdown that never should have occurred. Mr. President, we finally have the ability tonight to end this shutdown. We have put forth the Appropriations Committee working in a bipartisan way with members on both sides of the aisle and in both chambers, a package of bills that includes a continuing resolution that will reopen government immediately once it is passed by this Senate, the House, and signed into law by the President. It is legislation that, due to incredibly good work by Senators Jeanne Shaheen, Tim Kaine, Katie Britt, the White House, and many of us, will ensure that those federal employees who have been furloughed or laid off or forced to work without pay will receive their back pay, will be recalled to their jobs if they were laid off as a result of this shutdown. That will make a huge difference to these federal employees who have worked so hard to serve the people of our nation. This package of bills also includes three year-long appropriations bills that were passed by overwhelming margins, bipartisan margins, more than 80 votes in each case by the members of this Senate way back on August 1st. These bills are the agriculture bill, the agriculture FDA bill, which Senator Bozeman chairs that subcommittee, and it includes funding for the SNAP program, for the Women's, Infants, and Children's Nutrition Program known as WIC, for our farmers, for rural development, for our rural communities throughout this country. A very important bill, a bill that will take away the worry that families who are low income, that seniors who are low income and rely upon the SNAP program or the WIC program are feeling today about whether the funding is going to be there. That concern goes away with the passage of this full-year appropriations bill that extends until the end of September of next year. A second bill in this package is the Military Construction and Veterans Affairs bill. That subcommittee is chaired, I've actually mixed up the two subcommittees. Agriculture is chaired by Senator Hoeven, and the Military Construction VA bill is chaired by Senator Bozeman. They are both extraordinary chairmen who work in a bipartisan manner with their ranking minority members and with their House counterparts. Think about it. Tomorrow is Veterans Day. Wouldn't it be wonderful if tonight the Senate passes the bill that provides year-long funding through the end of this fiscal year to September 30th of next year for our VA? What a way to tell our veterans how much we value their sacrifice and their service, a debt to them that we can never fully repay. That is so important to get that bill through. And military construction projects, what a difference that makes to our troops all over the world. There are two that matter a great deal to me in the state of Maine. One that will help the Portsmouth Naval Shipyard, which I worked with my fellow senator from Maine and our two senators from New Hampshire, and one that will benefit the Air National Guard base in Bangor, Maine, where I live. I am so proud of that base. It does more refuelings than any base on the East Coast during wartime, and it is extraordinarily skillful and filled with patriots. They will be taken care of, Mr. President. And the third bill is the legislative branch bill. That bill answers concerns that a lot of our members have about security in this increasingly polarized and difficult environment in which we live. But that's not all, Mr. President. And I want to correct any misimpression that has been given by some who have spoken today on the other side of the aisle. The Senate Majority Leader has given a public commitment that he will bring to the Senate floor bills that extend the Affordable Care Act, which unfortunately has turned out to be anything but affordable, but it will extend the premium tax credits that allow our lower income and middle income families to afford their much needed health insurance. In many cases, these are individuals who are self-employed, so they do not get health insurance through the workplace. Or they're the employees of small businesses that are unable to provide health insurance, particularly in this time when we're seeing skyrocketing premiums. So as I've said from the beginning, I support an extension of the ACA tax credits, but they need reform. It is wrong that wealthy families qualify for taxpayers' subsidized tax credits for their health insurance when they can afford their own health insurance. That was a change in Obamacare that was made during COVID. We should take a look at what the original income cap was under the Affordable Care Act. It was 400% of the poverty level. Now, we can decide what it should be, but surely we ought to be able to agree in a bipartisan way that there should be some cap on income so that very wealthy individuals are not able to receive taxpayer-funded tax credits. Let's limit that to those who are in middle income and lower income families. So there are other great ideas that have been raised by our colleagues on how we can reform the ACA to make health insurance more affordable. And I know that the chairs of both the Health Committee, Senator Cassidy, who is a medical doctor, as well as Chairman Mike Crapo from the Finance Committee, have promised to have hearings to take a hard look at this, and we have the commitment of the Majority Leader to bring these bills to the floor. So it's just not true that we're ignoring this issue. We do need to act by the end of the year, and that is exactly what the Majority Leader has promised. In addition, he has pledged to bring additional year-long appropriations bills to the Senate floor, and we will be doing that shortly, and that is the right thing to do. I want to thank the eight Democrats who yesterday stood up for the American people and did what was right, pledged to reopen government, to pass these 3 appropriations bills that members of this chamber passed by over 80 votes on August 1st, and which will take away the threat of any kind of shutdown for the programs in those 3 bills. And as I mentioned, the last bill is the Ledge Branch bill. I want to thank Senator Mark Wayne Mullen for his leadership on that bill as well. We have terrific members of the Appropriations Committee on both sides of the aisle who have worked so hard. And I must say that I think all of them ought to be voting for this package of bills tonight. Mr. President, I made most of my comments yesterday when I brought these bills to the floor. There are others who are seeking recognition, so I will cease my remarks, but I just want to encourage everyone to cast their vote for this package of bills so that we can send it over to our House colleagues, where I hope they will do the same, and then send it to the President, who has already endorsed this package and pledged to sign the bill into law. Let's end this entirely unnecessary, shameful shutdown. Mr. President, I ask unanimous consent that there be 2 minutes of debate equally divided prior to each roll call in relation to calendar number 168, H.R. 5371.
Without objection. Under the previous order, all post-cloture time is expired. The question is on the motion.
President, I request the yeas and the nays.
Is there a sufficient second? There appears to be. Clerk will call the roll.
Ms. Also Brooks. Ms. Baldwin. Mr. Banks, Mr. Barrasso, Mr. Bennett, Mrs. Blackburn, Mr. Blumenthal, Ms. Blunt Rochester, Mr. Booker. Mr. Booker, Mr. Bozeman, Mrs. Britt, Mr. Budd, Ms. Cantwell, Mrs. Capito, Mr. Cassidy, Ms. Collins, Mr. Coons, Mr. Cornyn, Ms. Cortez Masto, Mr. Cotton, Mr. Kramer, Mr. Crapo, Mr. Cruz, Mr. Curtis, Mr. Daines, Ms. Duckworth, Mr. Durbin, Ms. Ernst, Mr. Betterman, Mrs. Fisher, Mr. Gallego, Mrs. Gillibrand, Mr. Graham, Mr. Grassley, Mr. Haggerty, Ms. Hassan, Mr. Hawley, Mr. Heinrich, Mr. Hickenlooper, Ms. Hirono, Mr. Hoven, Mr. Husted, Mrs. Hyde-Smith, Mr. Johnson, Mr. Justice, Mr. Kane, Mr. Kelly, Mr. Kennedy, Mr. Kim, Mr. King, Ms. Klobuchar, Mr. Langford, Mr. Lee, Mr. Lujan, Ms. Lummis, Mr. Markey, Mr. Marshall, Mr. McConnell, Mr. McCormick, Mr. Merkley, Mrs. Moody. Thank you. Mr. Moran, Mr. Moreno, Mr. Mullen, Ms. Murkowski, Mr. Murphy, Mrs. Murray, Mr. Ossoff, Mr. Padilla, Mr. Paul, Mr. Peters, Mr. Reed, Mr. Ricketts, Mr. Risch, Ms. Rosen, Mr. Rounds, Mr. Sanders, Mr. Schatz, Mr. Schiff, Mr. Schmidt, Mr. Schumer, Mr. Scott of Florida, Mr. Scott of South Carolina, Mrs. Shaheen, Mr. Sheehy, Ms. Slotkin, Ms. Smith, Mr. Sullivan, Mr. Thune, Mr. Tillis, Mr. Tuberville, Mr. Van Hollen, Mr. Warner, Mr. Warnock, Ms. Warren, Mr. Welch, Mr. Whitehouse, Mr. Wicker, Mr. Wyden, Mr. Young. Senators voting in the affirmative: Barrasso, Collins, Cornyn, Daines, Graham, Husted, Hyde-Smith, Kennedy, King, Lankford, Marshall, Moreno, Mullen, Rounds, Scott of Florida, Sheehy, Thune. Senators voting in the negative: Baldwin, Blunt Rochester, Duckworth, Ossoff, Paul, Wyden.
Mr. Schatz, no. Mrs. Fisher, aye. Mr. Cruz, aye. Mr. Kane, aye. Ms. Hassan, aye. Mr. Tuberville, aye. Mr. Kramer, aye. Mr. Scott of South Carolina, aye. Mr. Tillis, aye. Mr. Schmidt, aye. Mr. Gallego, no. Mr. Crapo, aye. Mr. Padilla, no. Mr. Lujan, no. Mrs. Capito, aye. Ms. Lummis, aye. Mr. Grassley, aye. Mr. Durbin, aye. Mr. Johnson, aye. Ms. Ernst, aye. Mr. Budd, aye. Mr. McConnell, aye. Mrs. Blackburn, aye. Mr. Young, aye. Mr. Kim, no. Mr. Heinrich, no. Mr. Reed, no. Mr. Ricketts, Mr. Ricketts, aye. Mr. McCormick, aye. Mr. Van Hollen, no. Mr. Welch, no. Mr. Curtis, aye. Mr. Wicker, aye. Mr. Merkley, no. Mr. Peters, no. Ms. Warren, no. Mr. Hoven, aye. Mr. Markey, no. Ms. Hirono. Ms. Hirono? No. Mr. Moran. Mr. Moran? Aye. Mr. Kelly. Mr. Kelly? No. Mr. Whitehouse. Mr. Whitehouse? No. Mr. Schiff. Mr. Schiff? No. Ms. Murkowski. Ms. Murkowski? Aye. Mr. Fetterman. Mr. Fetterman? Aye. Mr. Murphy. Mr. Murphy? No. Mrs. Murray. Mrs. Murray? No. Mr. Cotton. Mr. Cotton? Aye. Mr. Bozeman. Mr. Bozeman? Aye. Mr. Lee. Mr. Lee? Aye. Mrs. Moody. Mrs. Moody? Aye. Mr. Banks. Mr. Banks? Aye. Mr. Cassidy. Mr. Cassidy? Aye. Ms. Smith. Ms. Smith, no. Mrs. Shaheen. Mrs. Shaheen, aye. Ms. Cortez Masto. Ms. Cortez Masto, aye. Mr. Hawley. Mr. Hawley, aye. Mr. Sullivan. Mr. Sullivan, aye. Mr. Bennett. Mr. Bennett, no. Ms. Also Brooks. Ms. Also Brooks, no. Ms. Cantwell. Ms. Cantwell, no. Mr. Hickenlooper. Mr. Hickenlooper, no. Mr. Booker. Mr. Booker, no. Mr. Warner. Mr. Warner, no. Mrs. Britt, aye. Ms. Slotkin, no. Mr. Risch, aye. Mr. Coons, no. Mr. Justice, aye. Okay, so apparently. Ms. Klobuchar, no. Mr. Haggerty, aye. Mrs. Gillibrand, no. Ms. Rosen. Ms. Rosen, aye. Mr. Warnock. Mr. Warnock, no. Mr. Blumenthal. Mr. Blumenthal, no. Mr. Schumer, no. Mr. Sanders. Mr. Sanders, no.
On this vote, the ayes are 60, the nays are 40, and the motion is agreed to. The clerk will report the bill.
Calendar number 168, H.R. 5371, an act making continuing appropriations and extensions for fiscal year 2026 and for other purposes.
Mr. President, I call up substitute amendment number 3937.
Clerk will report.
Senator from South Dakota, Mr. Thune, for Ms. Collins, proposes an amendment number 3937 to H.R. 5371.
President, I ask the reading be dispensed with.
Without objection.
And I send a cloture motion to the desk.
Clerk will report.
Cloture motion. We, the undersigned senators, in accordance with the provisions of Rule 22 of the Standing Rules of the Senate, do hereby move to bring to a close debate on substitute amendment number 3937 to calendar number 168, H.R. 5371, an act making continuing appropriations and extensions for fiscal year 2026 and for other purposes, signed by 17 senators as follows.
President, I ask consent to reading the nays be waived.
Without objection.
And I ask for the yeas and nays on the amendment.
Is there a sufficient second? There appears to be. The yeas and nays are ordered.
Mr. President, I call up amendment number 3941 from Senator Paul.
Clerk will report.
The senator from South Dakota, Mr. Thune, for Mr. Paul, proposes an amendment number 3941 to amendment number 3937.
Mr. President, I ask that the reading be dispensed with,
Without objection.
and I ask for the yeas and nays on the amendment.
Is there a sufficient second? There appears to be. The yeas and nays are ordered.
Mr. President, I have a second-degree amendment at the desk.
Clerk will report.
The senator from South Dakota, Mr. Thune, proposes an amendment number 3942 to amendment number 3941.
Mr. President, I ask the reading be dispensed with,
Without objection.
and I have an amendment to the text of the underlying bill.
The clerk will report.
The senator from South Dakota, Mr. Thune, proposes an amendment number 3943 to the language proposed to be stricken by amendment number 3937.
Mr. President, I ask the reading be dispensed with,
Without objection.
and I ask for the yeas and nays on my amendment.
Is there a sufficient second? There appears to be. The yeas and nays are ordered.
Mr. President, I have a second-degree amendment at the desk.
The clerk will report.
The senator from South Dakota, Mr. Thune, proposes an amendment number 3944 to amendment number 3943.
Mr. President, I move to commit the bill to the Committee on Appropriations with instructions.
The clerk will report.
The senator from South Dakota, Mr. Thune, moves to commit the bill H.R. 5371 to the Committee on Appropriations to report back forthwith instructions.
Mr. President, I
Number
ask that the reading be
3945.
dispensed with,
Without objection.
and I ask for the yeas and nays on the motion to commit with instructions.
Is there a sufficient second? There appears to be. The yeas and nays are ordered.
Mr. President, I have an amendment to the instructions.
Clerk will report.
Senator from South Dakota, Mr. Thune, proposes an amendment number 3946 to the instructions of the motion to commit, amendment number 3945.
Mr. President, I ask consent the reading be waived,
Without objection.
and I ask for the yeas and nays on my amendment.
Is there a sufficient second? There appears to be. The yeas and nays are ordered.
Mr. President, I have a second-degree amendment at the desk.
The clerk will report.
The senator from South Dakota, Mr. Thune, proposes an amendment number 3947 to amendment number 3946.
Mr. President, I ask consent the reading be waived,
Without objection.
and I send a cloture motion to the desk with respect to calendar number 168, H.R. 5371.
The clerk will report.
Cloture motion, we, the undersigned senators, in accordance with the provisions of Rule 22 of the Standing Rules of the Senate, do hereby move to bring to a close debate on calendar number 168, H.R. 5371, an act making continuing appropriations and extensions for fiscal year 2026 and for other purposes as amended, signed by 17 senators as follows.
President, I ask consent the reading of the nays be waived.
Without objection. Senator from Wisconsin.
Shortly, I will move to table Amendment 3947 for the purposes of offering my amendment to extend the Affordable Care Act tax credits for 1 year. I am doing this because my Republican colleagues are refusing to act to stop health care premiums from doubling for over 20 million Americans. I just can't stand by without a fight. Americans have said loudly and clearly that they are in a health care crisis. That's not up for a negotiation, but it didn't have to be this way. We're at this moment because Donald Trump and congressional Republicans have simply refused to address the biggest increase in American premiums they'll likely ever experience. For months, congressional Republicans and Donald Trump have refused to even talk to us about addressing it. Estimates show that 22 million Americans will see their premiums double on average. I'm getting calls daily from Wisconsinites begging me to stay in this fight. A couple in Door County, Wisconsin, told me their premium is rising by over $550 a month next year. Everything is already too expensive. So where are they supposed to find $6,500 extra in their budget? Another couple from Butternut, Wisconsin, told me their premiums are going from $400 per month to over $5,000 per month. That's $55,000 more a year. As they wrote to me, health care tax breaks are not just numbers on paper. They are the lifeline that allows us to sleep at night knowing that we won't lose everything if one of us gets sick. Behind every one of the 22 million Americans who rely on these tax credits is a story, a family who has to put together a budget, who has to make the hard decisions of what they can afford for their family next year. Some are logging on to healthcare.gov right now and finding that they simply can't afford health insurance next year. That is unconscionable. Addressing this demands that we act now, not in a week, not next month, but now. That's why a handshake deal with my Republican colleagues to reopen the government and no guarantee to actually lower costs is simply not good enough. The people I work for need more than that. They need health care that they can afford, not a symbolic vote. For over a year now, I've been fighting to get a bill passed to avoid this very situation and make these tax credits permanent. My colleagues and I have tried every which way to get this bill passed. Every time my Republican colleagues killed the effort and put 22 million Americans on the path to pay more for health care next year. For 41 days, I've been clear. I will work with anyone to reopen the government and lower Americans' health care costs. And I'm not throwing in the towel until we've exhausted every option to make that happen. And that's why I've offered an amendment to extend tax breaks for Americans who buy their insurance through the Affordable Care Act for 1 year. My amendment is as straightforward as it gets. It would extend current law for 1 year, stop costs from skyrocketing for our constituents, and give us time to negotiate on health care costs without leaving 22 million Americans in the lurch. Is this everything I think we should do? No. We should make health care more affordable for everyone forever. But I am willing to compromise to avoid catastrophe for the families I work for. I am demanding that we take this vote so that we can actually provide some relief to millions of American families. The American people are desperate for health care that they can afford and demand that we do everything in our power to lower costs. This is a tool in my toolbox to try to lower their costs, so I'm using it. I've talked to so many of my Republican colleagues who want to do something here, who want to keep health care costs down for their constituents, who know their constituents in red states and districts will be hardest hit. Well, now is the time to show it. My sincere hope is that the Republicans join me so I can make this amendment to the continuing resolution and let 22 million Americans rest easier. I hope my Republican colleagues choose to join us. And now I yield to Senator Sanders.
I want to thank the Senator for Wisconsin.
Senator from Vermont is recognized.
Thank you. I want to thank the Senator for Wisconsin for offering this important and very simple and straightforward amendment. Nothing can be simpler. Are you prepared, I say to my Republican friends, to sit back and allow over 20 million Americans to see a doubling of their health care premiums? In my state of Vermont, people who are 65, 63 years of age will in some cases see a tripling or a quadrupling, and that is the case in your states as well. And all that Senator Baldwin is saying is, let us take a deep breath. Let us make sure that people do not see an outrageous increase in their premiums. Let us not pave the way for 15 million Americans to lose their health care entirely because of savage cuts to Medicaid. All she is asking. Now, I noticed that recently some of my Republican colleagues are beginning to talk about the health care crisis. Well, during Trump's first 4 years, he had virtually nothing to say about the crisis, nothing to say about it in the next 4 years, but I'm glad that there is some discussion. The truth of the matter is, in my view, that the current health care system is broken, it is dysfunctional, and it is cruel. But I want to ask my Republican friends a simple question. Are you happy with the fact that here in the United States we are the only major country not to guarantee health care to every man, woman, and child? We are unique. That's not the kind of exceptionalism we should be proud of. Are you happy that we are paying twice as much per capita for health care, over $14,000 per person, than any other major country, and yet we have 85 million Americans who are uninsured or underinsured? Are you content with the fact that the insurance companies and the drug companies are making huge profits, paying their CEOs exorbitant salaries? Are you happy with that? Are you happy that patients in America have to get on the phone and fight like crazy and deal with all kinds of bureaucrats in order to get the health care that they paid for in an incredibly complicated, broken system? So if you want to have a debate about health care, let's have that debate. I happen to believe that we should join the rest of the industrialized world, guarantee health care to all people through a Medicare for all single-payer system. You got a better idea, bring it forward. But what we should agree upon is that you don't raise premiums by 100% or in some cases triple or quadruple. Let's take a deep breath. Let's extend these ACA subsidies for another year. Let's have that debate on health care. That's what the American people want. And with that, Mr. President, I would yield to the Senator from Michigan.
Thank you, Mr. President.
Senator from Michigan is recognized.
Thank you, Mr. President. Rise today in support of Ms. Baldwin's amendment on a clean one-year extension of the healthcare.gov credits. Since July, I've been really clear. If you want me to vote on a deal, it's got to do something to bring down the cost of health care because of the health care crisis that Republicans in this chamber precipitated back in July. Just to review the bidding. In July, the big, beautiful bill, which all of you voted for, or most of you voted for, slashed Medicaid and slashed coverage for people on healthcare.gov. Now, all our hospitals, all our healthcare systems, all our nursing homes, everybody accepted that and started to plan. In response to that, the hospitals said, well, look, people are still going to come. They're still going to get in car accidents. They're still going to have heart attacks. They're just not going to be covered by health insurance. So we're going to have to charge the people with insurance even more money. So we are now at a point, this crisis that's been precipitated has led to the fact that every single American, everyone watching, everyone listening, is either facing losing their health insurance or paying more. And that includes people on private employer-provided insurance. When we take a step back and we look at all the people that are going to fall off health care, all the healthy young people who are not going to pay for health care anymore, it looks like across at least my state, every single person is looking at their prices doubling. Not just the people who are affected by the big, beautiful bill, but the bill payers, the people on private health insurance. Now, no one in this room would say that we are paying too little for health care right now. And I don't always agree with Senator Sanders, but I can say there is no more broken system in America than health care right now. It needs full rebuilding. We may disagree on some of the ways to do it, but the Republicans have offered zero plan, zero ideas. Hell, Marjorie Taylor Greene is talking about how Republicans don't have a plan. Never thought I'd be agreeing with her. So today, all we're asking for is a clean one-year extension. No one says Obamacare is perfect. No one says a clean extension is perfect, but you have pushed people back into a corner. You have said we're going to pay for our tax cuts on the backs of everyday Americans by using their health care as the bail payer. So can we do a one-year extension, please, so that we can have some kind of conversation, a real conversation that the American people expect people of our stature to be having? Can we have that conversation over the next year, but not, in some cases, have people's health insurance go up by 600%? That is what you have precipitated. So to every American watching, whether you're on healthcare.gov or you're on private insurance, if you're getting those letters, if you're getting those notifications of an increase of your bill of $200, $500, $800 starting January 1, my peers on the other side of the aisle are the ones you should lay it at their feet. Because they have put us in this place, and if they vote tonight against this, it's because they don't give a crap about the cost of your health care. They don't give one single crap about it. So I hope my colleagues find it in their hearts to say, let's fix the system, fine, but at least for now give us a one-year extension so we can have a real conversation. With that, I yield back.
Mr. President.
Senator from Wisconsin.
I move to table Amendment 3947 for the purposes of offering my amendment to extend ACA tax credits for 1 year. That's Baldwin 3950, and I ask for the yeas and nays.
Is there a sufficient second? There appears to be. Clerk will call the roll.
Ms. Alsobrooks. Ms. Baldwin. Mr. Banks. Mr. Barrasso. Mr. Bennett. Gotcha. Mrs. Blackburn, Mr. Blumenthal. Ms. Rochester. Mr. Booker. Mr. Bozeman. Mrs. Britt. Mr. Budd, Ms. Cantwell. Mrs. Capito. Mr. Cassidy. Ms. Collins. Mr. Coons. Mr. Cornyn. Ms. Cortez Masto, Mr. Cotton, Mr. Kramer, Mr. Crapo, Mr. Cruz, Mr. Curtis, Mr. Daines, Ms. Duckworth, Mr. Durbin, Ms. Ernst, Mr. Fetterman, Mrs. Fisher, Mr. Gallego, Mrs. Gillibrand, Mr. Graham, Mr. Grassley, Mr. Haggerty, Ms. Hassan, Mr. Hawley, Mr. Heinrich, Mr. Hickenlooper, Ms. Hirono, Mr. Hoven, Mr. Husted, Mrs. Hyde-Smith, Mr. Johnson, Mr. Justice, Mr. Kane, Mr. Kelly, Mr. Kennedy. Yes, you did. Mr. Kim. Mr. King. Ms. Klobuchar. Mr. Lankford. Mr. Lee.